lesson is safety and first aid. What is safety and what is first aid? Safety. First we have to be safety. Wherever we go, we have to be safety. Suppose if we are not safe, we have to take at least first aid. First aid means what? Before the doctor comes, you have to take first aid. Is it not, children? Before the doctor comes, you have to take first aid. Okay. Come back to the lesson. Somebody has eaten a banana and thrown the peel on the road. Has he done the right thing? Will we say, has he done the right thing? No, not at all. He has done the wrong only. Has he done the right? No. Will we eat banana and will we throw the peel on the road? No, we have supposed to throw it in the dustbin, not on the road. What would happen? An accident may occur any time, or somebody will be injured. What we have to do at that time? First aid is the first medical help given to an injured person before a doctor arrives. What we have to do? First aid is the first medical help. It is the first medical help given to an injured person before a doctor arrives. The most important thing while giving first aid is to stay calm. First aid. What we have to do? We have to stay calm. We are not supposed to shout or do something or like that, anything. We have to first stay calm before giving the first aid. Safety first. Safety on the road is more important than ever before because of the rapid increase in the number of vehicles. Nowadays, number of vehicles are increasing day by day. So, because of that, safety on the road is very, very important. Read and follow the road signs. See all of you how it is? No entry. See? What is this? What we call it as? No entry. Is it not, children? This is no entry. No pedestrians. Who are pedestrians? Who walks on the road are called pedestrians. So we are not supposed to walk on the roads. No pedestrians. What is this, children? You are not supposed to go towards left. No left turn. You are not supposed to go towards left. No left turn. Okay? No U-turn. No U-turn. You are not supposed to go to shortcuts also. No U-turn. Many accidents will happen if you take U-turns. Okay, children? You are not supposed to take U-turns. No horns. Simply no horns. You are not supposed to honking onwards towards your before your vehicles. No honking. Always honking. So if front any vehicle is there, before they will stop. No, you are not supposed always honking on. Okay. You are not supposed to horn. Okay, children? Yes. No right turn. This is no right turn. Speed breaker. So what you have to do? If you run your vehicle the speed of 70 per kilometer, then you will see the speed breaker. You have to slow down your vehicle so that there will be no accidents. If that is school zone area, the students will be coming on. Little kids, little children will be coming on. What you have to do? That is speed breaker area. You have to slow down your vehicles. Okay, that is if any school zone area or any food zone area or any traffic area, then that is the speed breaker area. So see once again, no entry, no pedestrians, no left turn, no U-turn, no honking, no right turn and speed breakers. Okay, these all you have to follow the safety rules on the roads. Always follow safety rules on the road and also at home. However, sometimes accidents occur in spite of being careful. Here are ways to deal with some emergencies. So these all are emergency rules. Okay children? These all are emergency rules. Coming for cuts and scratches. Do not neglect any wound, however minor. If any wound is there, you are not supposed to neglect. If it is minor one also. Minor means very small one also. Germs can enter a body through uncovered cuts or wounds and cause infection. So if it cuts, because germs or anything will enter here. Because there will be cut, no? It enters into our body and causes infections. Wash your hands before giving first aid as germs from dirty hands may infect the wound. We have to wash our hands. We have to sanitize our hands because the germs may enter if we first aid the wound. Wash away all dirt around the wound. If you are having wound here, what we have to do? We have to wash the wound. We have to clean the wound. Clean the affected area with cotton. You have to clean with cotton that affected area. Place a thick pad of cotton, wool or sterilized gauze on the wound and press it with your thumb and fingers. This will stop bleeding in most cases. So you have to press the wound so that all unwanted blood will be coming out or pus will be coming out and you have to squeeze it away. So you have to take all the pus out so that it comes away out and clean it with cotton. Okay. A tourniquet can be used. This is a bandage tightly tied over the wound to stop bleeding. So a tourniquet, that is a bandage will be used there. It must be tied very tightly to stop bleeding. When the skin is cut by a dirty or rusted object, germs may enter and cause a dangerous disease called tetanus. What is this called? It is called tetanus. Consult a doctor for an anti-tetanus injection. So, have to get anti-tetanus injection. Yes. For cuts and scratches. Next one for nose bleeding. What we have to do is nose bleeds. These all are only first aid. Keep the patient upright in a comfortable position with his head held back. So if nose bleeds, what we have to do? We have to keep this nose in the upside back. Press the bleeding side of the nose firmly. So you have to press the nose in this way. Keep an ice pack or wet cloth on the nose and head of the patient. You have to keep ice pack on the head of the nose. Here you have to keep the ice pack. Ask the patient to breathe through his mouth and not to blow his nose. Breathe through his mouth, not with nose. A little bit of bleeding from the nose is harmless, but if the bleeding is heavy, send for the doctor. A little bit is okay, but if bleeding is very heavy, you have to consult the doctor. Next, fur sprains. When the tissues around a joint get torn, we call it a sprain. So tissues around a joint, we call it as a torn, we call it as a sprain. Sprains cause swelling and sometimes discoloration of the skin. They are very, very painful. Keep on applying ice packs or ice cubes on the injured joint till the swelling subsides. You have to keep ice cubes. So the swelling will be getting subsides. Okay? Yes. For fractures, what happens for fractures? A crack or a break in a bone is called a fracture. So a crack or a break in a bone is called a fracture. Keep the patient calm and comfortable and send for a doctor. We have to keep a patient very, very calm and we have to send near a doctor. Apply a splint to give support to the broken bone and try to avoid unnecessary movement. We are not supposed to move like this, okay? We are not supposed to move with unnecessary movement. Any easily available article like sheets of newspaper, a piece of cardboard or a pillow around the injured bone can act as a splint. This will prevent movement and help the broken bone to heal. So it helps to heal. A sling made from a triangular piece of cloth can be used for support. So a sling also will be used for support. Okay children? Yes. What happens for burns? So if our hand is burned, what will happen? One can suffer burns from hot objects like fire, steam, boiling water, crackers, electric points and chemicals like acids. What are minor burns? Though minor burns are very painful, they can be treated at home. Let running cold water flow over on the burn until the pain subsides. So cold water we can pour it on our body. Apply an antiseptic lotion or cream to prevent infection. If an antiseptic lotion is not available, apply a paste of baking soda and water. We can also apply paste of baking soda and water also we can apply so that our body becomes very cool. If there are severe burns, what happens? Sometimes the skin gets severely burnt and blisters are formed. Never try to prick a blister. An open blister is an open wound. It can catch infection. So if any severe burns is there, it can catch infection. So we have to immediately consult doctor. Gently cover the burn with a clean piece of cloth because it immediately catches the germs and dust. If the victim is in state of shock, give him a warm drink. Never try to give a liquid to an unconscious person. Dip a sterilized piece of cloth in a solution of baking soda and use it as a wet compress. So we have to immediately dip it in a water and wet cloth we have to keep it on the body. Severe burns must be treated by a doctor. We cannot treat immediately at home. It must be treated with a doctor. Chemical burns. So chemical burns. Chemical burns means in laboratory like that they are chemical burns. Remove any clothing from the affected area. Use plenty of water to wash off the chemical. We have to use plenty of water to wash off the clothes. Cover the burn with sterilized gas and send for the doctor. We have to sterilize it and we have to cover it with cotton so that we can send for doctor. Okay children, we will see in the next class. Hope you have understood this safety and first aid, and in the next session I will be back. Once go through the lesson, read thoroughly If you have any doubts, I'll see you in the next class. Bye bye all of you. Thank you.